Good evening, everyone. Today, let's study about extraintestinal manifestations of inflammatory bowel diseases. As I had promised in the last video, I said I'll be taking the extraintestinal manifestations in the next video. So, here I am today with extraintestinal manifestations of IBD, which is inflammatory bowel diseases. So, extraintestinal manifestations of IBDs. These extraintestinal manifestations mostly occur in case of Crohn's disease, very rarely in ulcerative colitis. Okay, so it's going to be a very short video. Let's finish it off in one go. Now, coming to dermatological manifestations. So, here we have erythema nodosum. These are the dermatological manifestations, okay, of Crohn's disease. Usually only in 10% cases of ulcerative colitis you can see erythema nodosum, but mostly in 15% there will be erythema nodosum in Crohn's disease. Okay, so dermatological manifestations. So it's you can see these dark patches over the shin of a girl, right? So this usually occurs in case of Crohn's disease, which is an inflammatory bowel disease. Coming to pyoderma gangrenosum. Pyoderma gangrenosum. This is one more gangrenosum. So this is one more dermatological manifestation. Now here again it's mostly seen in Crohn's disease, very rarely seen in case of ulcerative colitis. So here you can see the lesion over the calf or over the legs. Okay, it can happen anywhere, but this will be the scenario. So you can have a look at it now in a very, very close manner. So this is pyoderma gangrenosum. One more complication is skin tag. Skin tags, as we all know, it happens after a fissure in the anal region, right? So we know that Crohn's disease can cause fissures. So due to this chronic fissure, there can be skin tag present in the patient of Crohn's disease. Another complication is stomatitis. Stomatitis is inflammation of oral mucosa, and there will be multiple ulcers in the oral mucosa. So this also is a complication of Crohn's disease. All these are mostly found in Crohn's disease rather than ulcerative colitis. One more complication. Can you identify what is this? It starts with the letter P. Yeah, it is psoriasis. This is also one more complication. These are all the dermatological complications of inflammatory bowel diseases, right? So we have erythema nodosum, pyoderma gangrenosum, skin tag, stomatitis, and psoriasis. What are the rheumatological complications? So we have ankylosing spondylitis. Ankylosing spondylitis, where there will be fusion of the bones, fusion of the vertebrae, causing bamboo spine. So ankylosing spondylitis can happen in case of Crohn's disease. So it's an inflammatory disease. There will be inflammation of joints, which will further lead to fusion of the bones. Okay. One more complication, rheumatological complication, is sacroiliitis. Sacroiliitis. So this is the iliac bone and this is the sacrum. So there will be inflammation in the joint between the iliac bone and sacrum, ala of the sacrum. So here you can see the inflammation. It's an inflamed joint, inflamed sacroiliac joint. Okay, sacroiliitis is one more rheumatologic complication in case of Crohn's disease. It usually happens in Crohn's disease more than ulcerative colitis. So these are the rheumatological complications. Along with this, there can be peripheral arthritis too. Okay, That's also included in case of rheumatological complications. So these are the rheumatological complications. Now, the ocular complications. In case of ocular manifestations, we have uveitis. Uveitis, it's the inflammation of uvea of the eye. So you know the uveal tissue, right? So that will be inflamed. Okay. So this is uveitis, and one more is episcleritis. Episcleritis. It will present in this manner. So episcleritis is the inflammation in between the sclera and the conjunctiva. There's a thin layer between sclera and the conjunctiva. So that will be inflamed. So these are the ocular manifestations. These are the ocular manifestations. Now coming to liver manifestations, we have gallstones, which is nothing but cholelithiasis. Liver manifestations, gallstones, cholelithiasis. So there will be formation of gallstones in the gallbladder, which can often lead to further complications with obstruction of the biliary tract or the pancreatic duct, etc. So, or it can lead to cholecystitis, choledocholithiasis. All these complications can happen. So this is about gallstones, which is an extraintestinal manifestation of IBD, and also this can lead to fatty liver. Fatty liver is one more complication, and we also have primary sclerosing cholangitis. Primary sclerosing cholangitis is often present in cases of IBD. 1 to 5% of IBD with colonic involvement. So this can also happen in case of IBD. We have other urological complications like calculi, ureteric obstruction, and fistulae. Fistula is one of the characteristic features of CD, that is Crohn's disease, right? So that can also be present as an extraintestinal manifestation in case of IBD. We have other complications, right? Like thromboembolism. These are the other manifestations: thromboembolism, vasculitis. So since these are the inflammatory bowel diseases, there will be generalized inflammations leading to pathological formation of thrombi, etc. So these can cause thromboembolism and vasculitis. Okay. And in some cases we can also see osteoporosis, usually due to usage of steroids. This osteoporosis occurs. It's increased in Crohn's disease with or without prior steroids, but in ulcerative colitis only after steroids usage. So in Crohn's disease it can happen either if we use, or if we just avoid steroids, it can anyways happen. There are increased chances in case of Crohn's disease, but in case of ulcerative colitis usually it happens after usage of steroids. Okay, so osteoporosis, which is nothing but, as you all know, the weakening of bones due to calcium deficiencies. And also there will be vitamin deficiencies. Vitamin deficiencies like B12, EADEK. B12 deficiency, since it is mostly absorbed in case of in ileum. So that if the ileum is involved in Crohn's disease, or ulcerative colitis, there will be less absorption of vitamin B12, leading to vitamin B12 deficiencies. And also EADEK, the absorption of EADEK usually happens in case of large intestine fat absorption. So that can also can be hampered, right, due to inflammation of this bowel. And other cardiopulmonary disorders can be associated. Cardiopulmonary disorders can be present along with IBD, and pancreatitis can occur. but it's rare. Rare. Okay. Also phlebitis, inflammation of veins. So these are the complications of extraintestinal complications of inflammatory bowel disease. So we can quickly summarize the extraintestinal manifestations of IBD. So coming to dermatologic, we have erythema nodosum. You can take this down if you need. So erythema nodosum, pyoderma gangrenosum, perianal skin tags, oral mucosal lesions, or stomatitis, psoriasis. Now let's go for, so these are the complications of dermatologic manifestations, which is erythema nodosum, pyoderma gangrenosum, perianal skin tags, oral mucosal lesions, or stomatitis, and psoriasis. Rheumatologic manifestations include peripheral arthritis, ankylosing spondylitis, sacroiliitis. Okay, rheumatologic peripheral arthritis, ankylosing spondylitis, and sacroiliitis. Ocular complications. We have uveitis and episcleritis. You'll remember it better with the pictures. That's why I presented the pictures to you before starting to list down the extraintestinal manifestations. It's always better to see how it presents and then study about it. All right, so you can remember it better along with the pictures. So as I've shown already, there is uveitis and episcleritis. Then we have hepatobiliary complications. Hepatobiliary complications. Here we have cholelithiasis, and PSC, which is primary sclerosing cholangitis, and we have fatty liver. Okay, now what about urological complications? Urologic complications. It can present with calculi, ureteric obstructions, and fistulae. And also along with that, we have other complications like thromboembolism, vasculitis, osteoporosis, vitamin B12 deficiency, ADK vitamin deficiencies, then cardiopulmonary disorders, pancreatitis, and phlebitis. So this is about extraintestinal manifestations of IBD. Thank you.